Dr. Auerbach, you see children in your practice. Tell us, what should a mom, a new mom, or mom anyway, what should she do and what should she not do with her child in order to prepare the child for good dental health? And as we see from other subjects you talked about, for good health, period, because with no doubt that mouth, those teeth are connected to a host of other physical problems a person could have. So what would you recommend a mom there, how to go about raising that child in terms of health care?
Okay, great question. A lot of people wait until the kids are 3 years old. The problem with that is they've had their permanent, or not their permanent teeth, but all of their 20 baby teeth for almost a year at least, and they could already have cavities. So you definitely want to get them checked up early and get on some good habits. So typically we say now that as long as you come in when their first teeth are coming in, we can discuss some good habits, and I'll go over those now, and we can check for any cavities. So the good habits, what you want to do is you want to make sure that the plaque, which is the film on the teeth, is wiped off at least a couple of times a day. You want to avoid sugary stuff. The sugar itself isn't the problem, but the bacteria that are everywhere in the environment, especially in the mouth, make acid when they feed on sugar. They love sugar, so they make more acid, and that's what makes the holes in the teeth. So you want to wipe that off. If you put the baby to bed or for a nap and they have this drink in their mouth that isn't water, there's probably some type of material in there that the bacteria can feed on it, and they'll be getting more cavities. So if you do any of that with the bottle, make sure it's just water. Then what we see now is sippy cups have been a bigger issue, that these kids walk around with juice or some type of liquid that isn't just water that's in their sippy cup, and they drink it all day long. So basically, they're feeding their bacteria constantly all day long. So you want to limit the exposure time to those products, and you want to clean the teeth. Water is the best if they're drinking something a lot. Having just water won't cause any damage to any of the teeth. So you want to wipe them off. You can wipe them with a little yarn or a washcloth, or they have little toothbrushes. You can do that. As the kids start to get older, they might want to, brush their teeth themselves. And what I recommend until they're probably maybe 4 or 5, that you definitely brush after they brush or before they brush, so that you can make sure it's done well. Now, when they have spaces between their teeth, you don't really need to floss too much. Make sure the brush gets in there. But on the back teeth, when they start to come in 1, 2 years old, there's usually a contact that's tighter. And you want to get the floss in there so that the plaque with all the bacteria in it is wiped away so it doesn't cause the cavities. So then you want to start flossing. Now, kids really don't have the dexterity until about 8, 9 years old to do the flossing themselves. So again, you can let them floss, but make sure you go over it and make sure it's getting done properly for them. Have them come in, like I said, when they first get their teeth, come in regularly, every 6 months at least, to have it evaluated, to make sure you're doing a good job, make sure there's no problems, stuff like that.
It's probably also pretty, relaxing habit forming, because, we are creatures of habit. And I guess, I think the last thing you probably want with a child is bringing to the dentist when the dentist needs to use the drill the very first time. That's probably not a good experience, right?
Right. Now, at our office, we don't want to stress out the kids. So if they're not cooperating, we just did a little friendly visit. We did all we can. We're not going to force them to do anything. So we get them used to, maybe we'll try in another couple of weeks or a month until we get them to cooperate and let us allow us to check, and they'll get used to it. They can watch you, because we see the families here, so they can come when you're getting your teeth cleaned and see how easy it is. And the same thing at home for habits. So as long as you have good habits, your kids will pick them up. So if you're brushing, flossing, the kids will see that, and they'll naturally want to imitate and copy what you do. So it's important for you to have good habits as well.
Right. Let's talk a little bit about, the switch from losing the first teeth to getting the permanent teeth in it. I do remember my dad hooking me up with a little, string to the door, and we made a big fun out of getting that thing out. And then it just stood out till the next teeth were growing in. So why should a mom get the kid through the hassle of the dentistry, including herself, because she probably needs to, go there, maybe spend money, all those things to fix and, cavities and things on teeth, which a couple, 2-3 years later are going to get replaced anyway. What's the deal with that whole thing?
Well, that's a good question. Now, the thing is, they're usually going to be in there a longer time. The last tooth, on average, doesn't come out of the baby teeth until about 12. So, and they start getting them, 6 months, a year. By 2, most kids have all 20 teeth. And then they last until maybe 6 or 7, and they start to lose usually the lower front ones and then the upper front ones. But those back molars, and they're important to stay, usually can stay in till, 12 years old. Now, if they're lost too early, there's a tooth that comes in at 6. It's called the first molar, and it's the back tooth, and it does not replace a baby tooth. So it's a permanent one, and we want to keep that for life. If the tooth in front of it is lost early, that tooth will come forward. Now you're going to have more orthodontic problems, more crowding, because there's not enough room for all the rest of the teeth to come in. So it's very important to keep those teeth healthy, to fix them until the permanent ones can come in.
I see. So basically, if the first teeth are getting lost too early, or maybe even for some reason don't want to come out when they should come out, then the teeth which come afterwards might not have a space, or maybe going in the wrong direction because there's no canal built for them one way or the other way, and then now you have your second teeth coming out crooked, and that spells a major orthodontic job, more than otherwise, or something like that. Is that what you're saying?
That's true, Helmut. There's a lot of environmental issues. So if a tooth is lost early, or if it doesn't come out on time, the new tooth either doesn't have the space or gets pushed, maybe out toward the lip, and you get those fangs, or maybe it's inside on the roof of the mouth because it didn't have a place to come into. But there are some genetics, so even if you do all of that right, the teeth may not come in straight because of, just look at how your teeth were, your husband's or spouse's or wife's teeth, or grandparents. There are some genetic issues as well. The other reason you want to keep the teeth healthy is because of infection. If an abscess on a tooth is an infected tooth and your body's fighting it, so that's a problem too. So you want to make sure the kids are healthy so they can do well in school and do whatever, and they don't want to be bothered by a toothache. Toothaches can be very painful.
Tell me. All right. So basically, even though those teeth are, you do lose them, you got to take care of them, because as you right now clearly said, an infected tooth is an infected tooth, and it will be daunting on your overall health, on your immune system, and whatever else it might be, and all that stuff. Well, all right. Thank you very much, Dr. Auerbach.